Hello everyone. Again this time Variety Vision team bringing you a special episode of this podcast where we are going to highlight real life story, expert opinion to bring ease in your life in Canada. I am Abhishek Dave, joined by my co-host Sanket Shah.
Hi everyone, I am your co-host Sanket, and in this episode we will talk about dental care system in Canada. This is something that everyone needs, but we are often not aware about the complete aspect of it. In this episode we will guide you how you can navigate the system and try to clear all your doubts. So don't worry, we have you covered.
So we have two experienced dentists from Moncton joining us, Dr. Rutav and Dr. Vidhi. Thank you for joining us. So before we dig further in this podcast, just give us a little introduction about yourself.
Right, so we'll start with me. So I'm Dr. Rutav and I got my BDS, the dental graduation degree from India, Maharashtra. And I got that in 2010. And since then I'm working, and I got the Canadian license to work as a dentist in Canada in last year. I think it was June 2023. Yeah, and then we moved to Moncton from last October. So that's all about me.
Thank you so much for having us today. Hi, my name is Vidhi Bhatt. I'm again the same introduction. I'm graduated from India, and I did my dentistry and I was practicing in India. We moved in 2020. He completed his dental part, his dental studies, and I'm right now giving my dental exams to pursue dentistry in Canada.
That's great. It's always good to hear your journey to come to Canada. Now to start with for today's episode, I would like to start with a very basic and important aspect that many people find difficult in Canada. That is to get first appointment for dental treatment. Coincidentally, now we are shooting this podcast, and recently our co-host Abhi, he faced some difficulties in securing an appointment where he was having severe teethache. Abhi, would you like to share your experience?
Definitely. It was my first experience with Canadian dental system. I came to Canada 10 months back. Last month I was having severe pain in my tooth, and I reached out to some of the dentist hospitals. Like I googled the details and I called them. It was like 15th of March, and when I called them, they were giving me dates of last week of April. And I was surprised how long how somebody can manage up to this much of tenure with this kind of severe pain. But yeah, that's what it is. So I want to know that is the scenario in Canada, that everywhere people have to wait for the appointments for that like 1 month or 2 months of time?
No, not really. I think it's more in New Brunswick and especially in Moncton, because I think in this part the proportion of dentists to the population is like less somewhat compared. But I don't think this should be an issue in big cities like Toronto or maybe Vancouver or somewhere like that.
Even I called you in first instant and you said, okay, you can go ahead and book the appointment. But yeah, I was not able to get any date sooner. So yeah.
So in such situation, and we have seen as an immigrant, like there are many targeted immigrant streams that government drives to get skilled workers from outside and fulfill the gap. I am sure like there must be something in relation to the medical field as well. But are there any things like that is stopping the gap to be filled earlier, or there are not enough programs? Can you share something about that?
So I think the government must have been doing something, because I see people with healthcare backgrounds getting a residency and they are coming to this country. But the thing is, in Canada we need to have a Canadian license to work in any healthcare segment. And acquiring that license, like depending on your field, it takes a bit of time. So I think that's why there is some backlog of I think that's.
So looking into current situation, like what you are saying, like there are not enough dentists in the Moncton city specifically, if I talk about. What happens when somebody have an emergency? I would rather say I want to discuss two kind of emergency. One, like in my case, when I was having a severe pain and I reached out and they were saying there is a delay for the appointment for around 1.5 months or 2 months. So is there anything that I can reach out in the early stage, like I can ask them for the emergency care? Second scenario, I also want to cover up, like is there any accidental situation? How a person can get immediate attention on that case?
Okay, so for the first part, so I think there are enough dental clinics in Moncton, but maybe it's the thing how things work here in this part of the Canada. Maybe that's why we feel that it's taking longer because we are no more used to wait for such a thing. Yeah, you can you can just call to a clinic and book for the appointment, and then for cases like if you have pain or if you feel that you need some urgent attention for that, for your condition, you can always let the clinics know that you have this kind of situation. And it all depends from clinic to clinic whether they are taking up new patients or not, and whether they feel that your issue is really an emergency or not. Because yeah, most of the times they can make out from your call, say for example you have a really big swelling, or you cannot open your jaw, or you cannot swallow, anything like that, they'll try to accommodate you as soon as they can. But in many cases, if say for example, to shift to the second question, like if there is some accident or anything, I think the best thing would be to if you can visit the emergency, or maybe if it is extreme, also calling 911 is the.
In current medical landscape of Canada, like everyone knows that getting any kind of healthcare, you're used to expecting a delay. In case of like dental treatment, okay, let's say I'm able to manage to get an appointment, but I understand there is certain procedure you have to follow, and from your first appointment to the start of actual treatment, it takes a while, few months rather. So can you walk us through the important steps that what you can expect from your first appointment till your actual treatment starts?
Okay. Yeah, so say for example you called a dental clinic, and then you got your first appointment booked. So it depends on for what you are visiting the clinic. So we at the clinic, we assess that. Say for example you booked your appointment just to get a routine check and see the for example, if our office is seeing you for the first time, then it goes there is a like pathway for it. So when you come for the first time, we check everything in the mouth, including the teeth and the tissues around it, like tongue, gums, everything, the cheek skin and everything. We make sure everything is okay, there is no sign of infection or anything. We take some x-rays just to make sure that, say for example, if you are still growing kid, like maybe a teenager, we make sure that the jaw and everything is in good shape. And also, so we start with that kind of exam, and then we see that what needs to be done, what kind of intervention you need. Like say for example, on the x-ray we find that there is a cavity in one tooth, so we just tell you that this is what we see in the x-ray, and then if it is urgent or if it can wait, we explain you all the things, and then we try to book you again.
So again, we have to wait for that long period of time for the next booking?
Yeah, I think that's how it works here. But yeah, if it is not urgent, then yeah.
Every patient should get a chance, right? Yeah.
So now I want to ask you something, like you have been called for the appointment, you went over there, you have been diagnosed it. I still remember my first bill for the primary diagnosis was around $700, which is a very high amount, seriously. If compared to back in India, where I used to pay, if I pay that much, I will get complete treatment. Anyways, so the thing is like, if this such huge amount we have to pay, what is the role of insurance? Because especially for the viewers who are recently came to Canada, or who are already in Canada but doesn't have the dental insurance. So this part gonna be very useful for you, that you should get an understanding that how important it is to have an insurance in Canada, especially the dental insurance. So can you describe the importance about that, and what exactly factor that contributes into this, like dental is a must?
Yeah, sure. So I think everybody should have their like dental treatment covered with insurance, because the dental treatments can be really expensive sometimes, and if you have insurance, that takes the bulk of the charges, and it makes it easy for you to get treated. And also like it covers many other things, like it makes it easy for you to go to like month like yearly, or routine, get a routine check and everything. Yeah, it definitely makes sense to have an insurance, because if you have not, then maybe some other things can take priority over spending over your dental treatment and so on. So yeah, I would recommend that.
In that situation, I think you have more anxiety about the budget than your pain, right? So insurance can definitely help in that.
I'll give you example. In my own case, when I went over there, I was not having idea that how much my current insurance plan is going to reimburse me. So first thing, I asked them what gonna be the budget, and as soon as they told me the budget, first thing I did to call my insurance coordinator, then ask him how much I gonna get reimbursed. If not, then probably I would have delayed this treatment. Another very important example I want to share with my viewers, a recent experience that one of our community guy whose parents visited to Canada, they were on a visitor visa, but he didn't secured any, availed any insurance for them. So since we are eligible for the normal Medicare system, visitors are not even eligible for that. He didn't took any insurance, and his father was hospitalized for some emergency Medicare, and there was a bill around $18,000, which was a really big sum of money, and an individual cannot afford that. Later on, though, community came together and it was a fundraising motion was there, and he somehow managed to get the fund. But the thing is, you should have insurance, especially when we are talking about this dental also. $1,000, $1,500 is not a small amount, especially for the people who are hardly managing their life in here, Canada.
While we are talking about insurance, one more thing I would like to touch upon, sometimes you don't get insurance through your employer, and then dental treatment cost can be very a cause of worry for you. I have heard there is something called federal dental plan, where government supports you for dental expenses. As a dentist, would you like to throw some light on it, so that we can have more knowledge? Who is covered? What's the eligibility and how it works?
Yeah, sure. So if you have a PR or if you are a resident of Canada, then you must all have heard about the Canadian Dental Care Plan. So for now, I think it covers up to the ages of 18 and then over 65 years of age. But I think soon, maybe in a couple of months, they want to cover all the population with that. But yeah, you can always learn more about on the website. Yeah, and for the say, for example, for if you are coming here on a student visa or something like that, I think the colleges secure some kind of insurance for you. They have the plans, and you can check with the insurance coordinator.
To say, either you get your insurance from your employer, or if you don't have it, if you are on a temporary status and you are not covered by any kind of federal plans, you can always look for personal insurance, and then that can give you some peace of mind in case if you have dental emergency.
Yeah, I think that's.
So when we talk about the college, as you mentioned in your last description, I want to ask you, if somebody who want to plan their career in the Canada, being as a dentist, so what are the phases he have to go through? What are the essential requirements to be a dentist in Canada?
Yes, a very good question. So there is two ways where you can pursue your dental eligibility, or as I say, if you are international dentist and you want to be a Canadian dentist, there is a two-way you can go through. So one is the way he did, like a dental exams. You have to pass NDB, NDEB. There are 3 set of exam. You can definitely check on National Dental Examination Board website, because they keep on changing their updates and it's not same for every year. So I highly recommend to check that. Second part, as everybody knows, you can go through as a college route, but still, again, a small catch. You have to pass your first part of this eligible NDB exam, and after that, just like an entrance exam, there is one more exam which you have to give, and then depends on college and university, you can pursue further. So
is that NDB exam is similar to what we have in India, like pre-medical entrance exams?
You can say like that, but it's bigger and more complicated structure of the exam. We just have a one entrance exam in India, or maybe in other countries as well. But here in Canada, it is a 3 set of exam. Individually, you have to pass all of them, and plus after that, there is one more entrance exam. So it's a set of exams rather than just one exam.
And in this, we pursue our careers for mainly 2 reasons in general: our passion, and then of course second is the monetary benefit. So this is more of a personal questions, but if someone wants to pursue a dental career in Canada, what do you think they can look at earning potential? Where do they start, and how high it can go with your experience and your skills?
Yeah, so for example, if you are just starting and say you're working part-time, full-time, different hours. So it basically depends on the area where you are working and what kind of treatment you do. But basically it starts from say 75,000 per year, and it can go up to like maybe 100,000, 200,000. The sky is the limit actually, because as much as you can do, you can. Right?
So next question is for you, Vidhi. When you come to Canada, especially everybody is rushing to be in the metro cities. Why you come to an urban area, especially the mountain?
Yes. So, okay, always whenever we talk about any cities or whenever we are migrating to a new cities, very basic factors we keep in mind. First, of course, affordability. Secondly, we want to be safe and happy. We want to celebrate our culture as well. So, in a mountain, we got that option. It is a really affordable city, I must say, because we shifted from Toronto, so it's a hence proved. Secondly, regarding to the cultural thing, as I mentioned, it has a diversity of culture. You can always learn different things from a different people, which is always a good idea. And thirdly, I think what he initially mentioned, we actually saw the population and the dentist ratio and the gap in between that, and we really like to offer our services where it's actually needed. So that's again a reason why we chose mountain.
So more opportunities for you and good for community, a win-win. That's really ideal. If let's say we have here a system of family doctor, where generally although there is a long wait time, but you still get assigned a family doctor. Is there something like that in the field of dental treatment as well, like where you get assigned to a clinic or like you have a family dentist?
Yeah, so for I think it works differently for the dental clinics, because you can go to whichever clinic is convenient for you. Given that they are accepting new patients, I think you can get enrolled with the office of your choice or of your convenience. But yeah, in case there is no like centralized list how we have for the family doctor here in New Brunswick. I don't think it works like that here.
So just like you received an appointment and you went over there, the primary diagnosis was done, they made a report for you in the system. Now if you want to change the doctor, you are not confident, or there can be thousands of reasons behind it, you want to change the doctor. Is it really allowed here? Like you can go to other hospital, there also they follow the from stage first, or they just continue with the stage second?
So say for example you moved to a new place, and now say you have been going to dental office A, and now you find that the dental office B would be more convenient for you. So I think you can just simply go to the dental office B and let them know that you would like to come there, and they just need a sort of approval from you that they can get all your info from the old dental office, and once you approve of that, they can get all the information, maybe old x-rays, and then they can see from where they have to go.
So now I want to ask you, like, do you want to give any suggestions or any like expert input to our viewers, like what precautionary cares they have to do for their dental health?
Yeah, sure. So as we all know, prevention is always better than cure, so that we have to keep in mind, and it is a very simple regimen which you have to follow. Twice a day brushing, morning brushing, before you go to bed brushing is the must thing to do. I know we are not that habituated, but it's always make that habit. So that is the first thing most. Secondly, which I love about the Canadian dental system, must visit your dentist every 6 months, because sometimes you don't know what is going on in your oral cavity, but they know, and they can give you the early stage recommendation and you can get it done. As for example, if you have a small cavity, would you like to go for a root canal treatment and you want to pay a $2,000, or you just want to get it done when it is on an initial stage? So that is a very beautiful thing. You must visit your dental hygienist or a dentist on a regular basis. And one more thing I want to add for the international dentist as well, whoever wants to come and pursue their dental careers in Canada as a dental hygienist, as a dentist, as a dental assistant, please do come, don't hesitate. They have a multiple programs, they help you for the funds as well, and definitely check National Dental Board examination website.
Thank you, Vidhi, for this valuable insights. And especially I found the answer because I was looking for, when my dentist asked me to visit every 6 months, and I was like, why he is calling me every 6 months? Now I have the answer. I hope you guys also found the answer for your questions, your queries. So this was a detailed informative video. We tried to create and present information in front of you so that you can find answers for the query running in your mind. Still, if you have something running in your mind, so you can simply drop us an email. The email ID tagged in below in the description. Also, you can find the same on the screen. And if you like this video, don't forget to like, subscribe, share and comment. Also, we will be back soon with more informative video, with more real life stories. Till the time, thank you so much for joining us. Thank you, Vidhi.
Thank you.
Thank you so much. Yes.
Thank you.